Good evening, everyone. I am Kenyatta Arnett. I am going to be facilitating a discussion tonight with some people from the New Jersey area, more particularly from Burlington County, New Jersey, my home area. I'm doing this in partnership with Sisterhood Incorporated, which is a nonprofit organization there in Burlington County. And so tonight we want to share some wonderful information with you and just some pertinent information for those in the Burlington County area and the surrounding areas of New Jersey. And so tonight we have a number of guests that are with me tonight, and I'm honored to have each of them with me. And so in just a moment, I'll have them introduce themselves and tell you more about who they are and the work that they do. And again, we're waiting for a couple more people who will be joining in with us. And so you'll see as some more people join in the broadcast as we go on. And so we want to make sure this is this next hour is informative as we come to share information with you about the COVID-19 pandemic and where we are and what we need to be doing going forward. All right. Our whole focus is about saving lives. And so tonight I have some guests with me, Miss Janice Phillips. I have Chief John Fine, Dr. Norma Bowe, and Miss Reva Foster, who's having some technical issues, but she's going to be right on with us in just a moment. And so as we're going forward, I'm going to ask if Miss Phillips, would you introduce yourself, tell us who you are, what you do? You can go ahead and unmute yourself.
Okay, I'm unmuted. Can you hear me? Okay, I'm Janice Phillips, and I'm a retired educator. I've got at least 40 years of education. I'm still working in education, but I'm formally retired. I was a speech language therapist and a special education teacher. And that's what I did.
Awesome. Thank you so much. Chief John Fine, I think many people need to know who you are.
How are you? My name is John Fine. I'm the Chief of Police for Burlington City, Burlington County, New Jersey. I've been a chief of police for a little over 2 years now, been in law enforcement for almost 20 years. In addition to that, I am a executive board member of the FBI National Academy Associates, executive board member for the state of New Jersey. And also I'm an adjunct professor at Rowan College of Burlington County for criminal investigations and juvenile delinquency.
Awesome. I'm a graduate of the previous Burlington County College.
I'm up your way, graduate of Fairleigh Dickinson.
Oh, okay. Awesome. Dr. Bowe.
Hi, good evening, everyone. I'm Dr. Norma Bowe. I'm a full-time professor at Kean University in the specialty of public health. I'm a nurse by background, and my PhD is in community health policy. And I'm also the executive director of a nonprofit called Be the Change NJ. We do all sorts of work in the community, but since the pandemic, we've really been focused on our emergency pandemic food pantry, which started out with 10 families and it's grown to 300 families since the beginning of the epidemic. And I'm also a vaccinator for Union County, doing whatever I can to bring supplies and bring resources to the community during COVID.
Awesome. Thank you so much. And let's see if Ms. Foster is, Ms. Foster, are you there? If not, we can come back. All right. I'm going to give her a minute. She's having some technical problems. And then, let's see, Kyra, are you sharing with us tonight, Kyra? All right, so we're going to go forward, well, with those who are on. So again, thank you for joining me tonight. There is an urgency. I'm sure we will all agree that there is an urgency for the work that we're doing and the efforts that we're making with regards to the vaccine. And when Pastor Covington comes on, or someone from her organization comes on, I really want them to talk about the work that they're doing, this grant that they're working on and how we're all helping them in their efforts in this grant during this pandemic. And so I just want to talk. What is it that what are you? What has been your experience? And anyone can jump in. What has been your experience with regards to the pandemic? Because after a year in, we've crossed over the year mark now. As a public school educator, we just realized we had been out of our building for over a year. In fact, just yesterday, our students at my school came back in the building in a hybrid model, and we were displaced from our building on March 13th, 2020, and so much has happened in this last year. What has been your experience with regards to the COVID-19 pandemic? Anyone can jump in. Yeah.
Well, I can start off by saying I too was going into my school building, and we were closed about a year ago. But the issue that I experienced was finding and getting the vaccine. My family registered on the NewJersey.gov website, and we waited, to hear from them. And then we started seeing other places offering us to register, such as Walgreens and Rite Aid. And we, quickly put our names on those lists. So our issue was we weren't getting the calls. We were not getting called at all to get our vaccines. And my mother, who was 103, we were concerned about getting her vaccinated. And so that was a big challenge. That was a challenge.
Right. And I can echo your sentiments on that, because that has been an ongoing challenge. Because I had the same experience. My mother had the same experience there in West Hampton. She lives in West Hampton. And that was one of the things that she had. She's a veteran, but she was having a hard time getting the vaccine, getting a location. And then she happened to get a location there in Burlington. Well, she got it at Care One in Morristown. And there was an error on her return date. So they gave her the wrong return date. And so they wouldn't give her a second vaccine. And so she had to go and do a hard dive trying to find a location that would be willing to just give her a second vaccine. And so it was very stressful for her as well. And so definitely I understand. And as a teacher, no. Even though we were in group 1B, according to the breakdown, we were in 1B. 1B. But yeah, and we couldn't get it. Yeah.
No,
we couldn't get it.
That didn't help me at all.
No, the categories didn't help me either.
No.
It really didn't. Dr. Bowe, I'm sure you have some stories as a nurse, and what can you share with us about your experience?
Well, first, I really want to say, Ms. Phillips, that I'm so sorry that you haven't been able to be successful in getting vaccinated. There's just a real disparity between who's getting vaccinated and who has to wait longer and who hasn't been able to get a vaccine. I also was out of my building for a year. I recently went back to my office to get something, and it was like a time capsule. And so from my experience, the Center for Disease Control first said we didn't need masks. I was giving out masks like crazy a year ago because I knew that this was coming, and I knew it was airborne, and I knew it was going to make a lot of people sick. So all of the misinformation that we got in the beginning really added to so many people being sick and so many people dying really needlessly. Now, as a nurse, I teach full time. I just got off of a class now. When I'm not teaching, the most important thing I can be doing right now is vaccinating. But unfortunately, the way the vaccines have rolled out, if you're not computer savvy, if you're not able to stay up till 2 a.m, 3 a.m, waiting for appointments to drop, if you don't understand the system you have to have all your information ready to go and you have to hit refresh every 5 minutes. Well, your mother who's 103, she can't do that. So a lot of people are not being vaccinated, not because they don't want the vaccine, but because it's been so difficult, right,
That's
to
the
get into
thing.
the right system to get
Right.
the vaccine. And it just shouldn't be that way.
Well,
Wow.
actually,
My opinion.
there's a second part. There's a happy ending to my story. I didn't tell you everything. We were actually given the opportunity to get our vaccines through a faith-based initiative, wherein the city of Trenton was given a certain number, I don't know how many, of vaccines to be disseminated through the Black churches. And so my pastor was able to get a certain number of vaccinations for his congregation. And since my mother is one of the centenarians, there's 6 centenarians at our church. She's the eldest. She was able to be right on that list. And as her caregivers, my immediate, my husband, myself, my god sister, my daughter, we were all able to get vaccinated. So that was just a blessing, because
Right.
otherwise we were sitting and waiting. So we've all gotten our first and our second. So we're all completely vaccinated, thank God. But had that not happened, I have no idea if we would have been called.
Right. Chief Fine, what
So
has
glad
been
to hear that.
your experience in especially coming from a law enforcement perspective?
So there may be some questions on, how does it affect law enforcement? And to be honest with you, it changed policing. COVID-19 changed policing on how we had to interact, but also provide an opportunity to get closer with our community. And this is the reason why, is because nobody suffered a pandemic in the last 100 years. And here is an opportunity, an unfortunate opportunity to really everybody join forces for the same purpose. And we see what's going on a lot around the country where there's a lot of division. And I could say I'm proud to be from Burlington City. Pastor Covington has been pretty much my second mother in Burlington City since I've been a young patrol officer. And I'm born and raised here in Burlington City. So when COVID-19 happened, I had COVID in November, and we had 5 or 6 officers. So on the internal side, we had to make sure that we had to keep police officers safe. Being an EMT for the last 17 years, I had to make sure that other first responders were also safe. But in addition to that, we knew that there was also a lot of stress on families and on the family unit in town. Burlington City had a high poverty. We have a higher poverty than a normal rate around the county, with over 60% of children on the free reduced lunch list in Burlington City. So we knew that there's a need in the household. And a lot of times these kids, if they don't go to school, they may not eat breakfast or lunch. So we teamed up with the City Strong Initiative and teamed up with our school district and went to all the playgrounds around town. So once these students were done classes, they could come outside, find a police car, and we will have their breakfast and lunch.
Awesome.
We also teamed up. We just eclipsed 35,000 meals served to our students. In addition to that, we also had Fun Fridays. We had private donations to get Chick-fil-A, to other kind of treats for the children who are going under a lot of stress. And I think that the stress, the internal stress, the family stress is really what's triggered a lot of issues a lot of times in the community, that we know that a lot of these kids are in crisis and they need support. In addition to that, we put 2 drive-through food pantries. We worked with our local NAACP, along with the Willingboro Police Department and also faith-based organizations and our police chaplains. And we served box meals, boxes of food to residents, over 70 residents that are disabled, that didn't want to come outside due to COVID. We had our young officers serving food and serving meals to families that needed it. And we've done almost 1,800 families and almost once a month. So that was also very successful, because we know that we always use to protect and serve. Well, we have some protection, but the community really needs serving and the service of the police department. So our mission really changed in COVID. In addition to that, now in the recent months, we know the vaccinations came out. So we did team up with our partners, like Ms. Phillips said, talked about the the Black churches, knowing that the African American community really needed representation in the vaccination opportunities, we partnered with Tabernacle Baptist Church, Christ
Yes.
Baptist Church, through the direction of Senator Singleton, our county commissioners, and county board of health department. And Tabernacle Baptist Church, about 2 weeks ago, was able to vaccinate 3,000 people in Burlington County.
Wow.
In addition to that, we were able to work with our local leaders and get 20 senior citizen residents in our higher poverty area, minority senior citizens, and get them to another vaccination point. And again, we're making that the buy-in, and we're trying to get. We offered rides. If I could get a senior citizen vaccinated and using a police officer to do that, that's as much community policing as going out and speaking to the kids. So again, the paradigm had a shift. And I can tell you in Burlington City, it's been very successful. We still have work to do. Unfortunately, I think this new strain has really taken a hard hit on some of our local residents. We lost 3 notable residents due to this new strain of COVID. And what we're seeing is a lot of young people are going in that are not protecting themselves. They're going into houses and getting grandmothers and aunts and uncles sick. And while the young people are surviving, we're seeing some deaths because of the elderly residents and some of the family members, which is also starting to create some internal friction with families. So I guess one big thing is that we need to possibly, exactly what Dr. Bowe said, is we need to kind of be more out there. A 90-year-old female may not know how to use the internet as well as we do. And we need to have more outreach, maybe mobile sites, and we need to kind of hit the streets more and senior citizen complexes more. That's what we're seeing here in Burlington City. But overall, I'm proud to be from Burlington City, and I can tell you our community has really surrounded everybody, and it's really been trying to work together.
Let me say thank you for the work that you've done and how you what you just said about changing the paradigm. And I believe that as we're going forward, we're all going to start seeing the need for a paradigm shift in how we do everything. And I think the work that you just mentioned in Burlington City is so commendable for the police department. Let me ask you also, Chief, are the police officers being required to get vaccines?
So it's not a requirement. It's highly suggested, but I can't require them. Now our police chaplains, we also offered it to our police chaplains. Pastor Hilda Kelvington from Sisterhood was one of our first police chaplains in our police department, really bridged a lot of gaps and taught most of us a lot of good life lessons. And she's been a mentor of us. So we have offered to our police chaplains and all of our police officers. And again, like I said, we're trying to work through this together here in Burlington.
Awesome. Well, I'm honored that we have Dr. Breda Thetford from Sisterhood who has come on in to join us. Dr. Thetford, how are you? Go ahead and unmute yourself.
Sorry, I'm doing well. Thank you so much for having us. I appreciate that. Reverend Covington will be on shortly, but I just wanted to represent Sisterhood if there's any questions at all. And I thank all of our panelists for joining us this evening. Again, it is Reva Foster wanted to be here. Did you want me to share that information right now?
Yeah, she was with us and she was having some computer issues and she was trying to do it from her cell phone.
Yes.
Because her iPad killed over. And so 2 things, if you would do, well, you can tell us her piece, but could you tell us about the grant that Sisterhood has just begun in Burlington County?
Yes. So with Sisterhood, we received a grant from the New Jersey Department of Health, and we are excited about that because it really is about COVID awareness and COVID prevention. So as Chief Fine said, Reverend Covington was one of the first police chaplains to get the vaccination. And we have to hopefully when she comes on, she can talk a little bit more about that experience. But the press is really to work for Burlington County. Burlington County is one of the largest counties in New Jersey. And we really would like to work collaboratively with everyone to ensure that we are bringing COVID awareness, not only to Burlington County, but for the state of New Jersey as well. And we're offering COVID testing. We're going to also offer vaccination. sites as well. And then I just want to kind of piggyback on what John was saying in regards to seniors being vaccinated, because that was Reva Foster's work that she's going to be doing on April the 18th with the Senior Center. And so do you want me to share that number or just put it in the chat?
Yes, you can share that. Please do.
Okay, so it's the number is 609-877-8444, 609-877-8444, and that will be on April the 18th at the John F. Kennedy Center in Willingboro. There will be vaccinations done through Rite Aid there. So we're excited.
It's April what?
I'm sorry?
What was April? What was the date again?
April the 18th.
18th.
April the 18th. Yes.
The JFK Center?
Yes, the JFK Center right there in Willingboro.
All right. Awesome. I'm going to let that banner scroll for a minute. All right, so people can get that information. Now, Dr. Thetford, let me also ask, what can we do to help sisterhood in its prevention efforts and prevention work? What is it that sisterhood needs? Oh, I think she's frozen. All right, we'll come back to her in just a moment once she unfreezes herself. But let's continue on. I was looking at some statistics for New Jersey, because this pandemic has just, I mean, we're almost near 600,000 deaths now, which is astronomical to believe that in a year, we have almost lost 600,000 people to this pandemic. New Jersey currently has reported about 934,000 COVID cases. Of those cases, 4% have been in Burlington County, which equates to about 41,000 cases in Burlington County. And in Burlington County, well, there's been about 25,000 deaths across the state of New Jersey, and 800 of those have been in Burlington County. What can we do? There's definitely an urgency with regards to those staggering numbers. My family, it's personal to us because we have loved ones who are in that 800 deaths in Burlington County. Who we have people who are in that number who have died from COVID in Burlington County. So it's very personal to us. But what can we do? Because obviously the number is not getting ready to go down. And they say now we're in this fourth wave. And Dr. Bo, I'm sure you can speak more to that. We're in this fourth wave, and they're projecting that it's going to go much higher. So where are we?
Yeah. So we're in the beginning of the fourth wave. You're so right about that. I think people have pandemic fatigue. We're tired of social distancing. We're tired of not seeing our family, right? And people are getting lax. Unless it personally hits you, people aren't taking precautions as seriously as they should. A lot of states have lifted restrictions. People are traveling from state to state. The variants are very contagious. Just this week alone, I've heard of at least 6 more deaths. My students have been hit particularly hard with COVID. I had a student who, oh my God, lost her grandfather, her favorite person in the entire world, on a Saturday. And 2 weeks later, her mother died in the same ICU that her grandfather had died in. It's hitting people of color disproportionately. And, I just feel like people need to stay on top of the social distancing, masking, washing their hands, using hand sanitizer, staying away from crowds. I'm disturbed by photos that I see posted on Facebook of parties and family gatherings until we have more people vaccinated. Now we're on that train at this point. On Saturday, there was a record 4 million vaccines given in one day in the United States. And we need to keep that going. and we have to get everyone vaccinated. But in the meantime, we have to take precautions and take them seriously.
Yes, I definitely agree. I think we're jumping too far ahead too soon. We're moving out of time, and the backlash is because we don't know what the backlash is going to be, and then with all these multiple variants. Matter of fact, could you say something about the multiple variants? Because I agree, people are. In fact, the teachers at my school were talking today about how COVID fatigued we are from doing education, but we also realize we can't stop. We can't stop being protective of ourselves, even though some of us have been vaccinated. We know we still have to be protective. But now the discussion is moving toward all of the multiple variants, and I think it's important for people to understand, what do they mean by variants?
So the virus is mutating, which all viruses do, right? So that's why we need a different flu vaccine every year, because there's the flu vaccine mutates. The flu mutates, and we need new vaccines every year for that. We're starting to see the mutations of the COVID virus. So the ones that we hear the most about, of course, are the ones in the United Kingdom, which they say now is in every one of the 50 states. We're hearing about the South African variant, which we're seeing in many of the states. And there's a very potent variant coming out of Brazil. Brazil is being hit very hard. People travel back and forth to these places. There aren't travel restrictions. We haven't closed our borders. We haven't, people are getting on airplanes and they're flying to different places. Some people may be asymptomatic, but give it to someone else who really gets a very severe case of COVID. Right now, it looks very promising with the 3 vaccines that we have available. It seems to be covering a lot of those variants. So we've got to, just keep the vaccination going. We have to vaccinate people. And, my concern is that there's so many people very reluctant to be vaccinated. Are you all finding that in your communities too, where people just are afraid of the vaccine and don't want to get vaccinated?
Anybody feel free to answer, because I know I can say yes. And for more than one reason, especially in the African American community, you have a lot of medical fear because of the history of medical studies and unethical practices against African Americans throughout history, and people are very reluctant. In fact, we had a conversation with my aunt, who's near 70, who's still reluctant and pretty much refusing to get the vaccine because she says, I don't know what's going to happen if I get it, and so I know I've experienced it, and still contending with people who don't want to get it because they bring up the Tuskegee thing. Dr. Thetford, have you heard people bring up the Tuskegee experiment? And so many other things like that. Yeah.
I was going to say, I think Janice might be able to speak a little bit about that. I think she had some experience in regards to that with her mom, and just trying to be able to be vaccinated.
She shared with us.
I did share that, but to speak to what you just mentioned, Kenyatta, I do have some family members and friends who are just leery about getting vaccinated. They're just not certain about side effects. They feel as though there hasn't been enough testing done, and that is making them hesitant to get the vaccine. So that I've experienced that as well.
Yeah. Chief, I'm sure you hear it as well. I'm sure people on your staff, everybody's not as gung-ho to go and get a shot, even though they're supposed to be the brave, the bold and the brave.
I'm not, I'm a 20-year veteran here, but it's our younger officers that a lot of times that, it's not going to affect me. It's not going to affect me. And you see that on the street as well. We see a lot of young adults congregating without masks, without social distancing. And like I said, we lost 3. I lost my one Pop Warner football coach because of COVID. But I can tell you the most recent case, I was at a family's house where the aunt was going to die from COVID, and it was brought in by one of the nieces, which created a divide in the family where we were trying to mediate. because the niece was fine after that, and all of a sudden now the aunt's gonna, she had diabetes, a couple other issues, and she wound up passing away. So, in a very prominent family here in Burlington City in the African American community. So, we are seeing that, and we're starting to see the congregating. But the one thing I could tell you, like what I think Dr. Bowe was talking about, was the fatigue and the mental health part of it. We are seeing increase in mental health crisis, and I think it's all of us. It's not just people that are it's everybody, including myself. And what I could just ask everybody to do is call 5 people that you haven't seen. Call 5 people one person a day, and it could be a friend of yours, whatever. And just check up on that person, because I think that we're losing that personal discussion, that personal, and just sometimes we're getting so we're so inside right now, and a lot of times that's creating anxiety and stress, which then in turn creates crisis, and then at that point, that's when the police department gets called for a mental health crisis or a breakdown or a domestic dispute. So, in Burlington City, I could tell you in our one area that, like I said, it's predominantly African American. We've now partnered with Volunteers of America, and I took an officer off the street and assigned him, and we're going door to door right now with Volunteers of America, which is a social service organization. And we are going door to door and asking the families, what can we do to help? Is there anything that you need help with? Is there a utility bill you need help with? Is there any kind of counseling that you need? Is there anything that your son or daughter needs? And we have our school resource officers providing assistance to that. So again, we're changing the paradigm and becoming much more of a service-oriented department than we are an enforcement end. So that's been very effective. But we're going door to door where people haven't come outside for a few weeks. But a lot of times they just want that engagement and they just want to talk. So please, if anything comes out of today, just call one friend one time a day. I'm trying to hold myself to that, and it seems to be pretty effective, not only for my friend, but also myself.
Awesome. Thank you for that advice. I think that is such helpful advice. And I'm going to take a personal note and say, Dr. Thetford does that. She's one of my 5. She will call and aggravate me to make sure I'm still alive and kicking here in Baltimore, and I appreciate her for that, because we kick back, and it has helped. I know it's helped me, and it helps her because we both had losses in our families over this past year as a result of COVID, and so we have been able to just share with each other and encourage each other throughout this year, and it has been a blessing and a help. So thank you, Dr. Thetford.
Thank you too. Thank you too, Dr. Arnett. Thank you. And Dr. Bowe has been so instrumental today. She actually donated to us PPE supplies. So again, we'll be able, Sisterhood will also be giving out PPE supplies on Fridays when we have our food giveaways as well. If you need anything, just let us know at Sisterhood Incorporated, because that's what we also want to make sure that you have masks to wear. If you have hand sanitizer, those are things that are very important. And you don't have to pay for them. They're all free. So we do have them at Sisterhood, and we're grateful to Dr. Bowe also for her generous donation today. I was able to be with her real briefly, but we were able to get together for that. So thank you, Dr. Bowe.
Awesome. Dr. Thetford, we were asking earlier if what else do you need? Well, first off, could you tell people where Sisterhood is located?
Yes.
Because I don't think many people know where Sisterhood is.
We are on 132, 136 East Broad Street. We are that white building right off of York on the corner. So we do have food giveaways. We do food donations every day, but our biggest food donations are on Friday. We have clothing donations, but because of COVID, we are, you have to call us to make sure that someone is there to help you, because we're also trying to social distance and make sure that we are keeping you safe as well. But because of this grant, we have PPE supplies, hand sanitizers. We just want to really get things out into the community. I was talking to Officer Fine this morning in regards to just seeing the basketball courts in Burlington City and just seeing how people are out there and they don't have on mask. And, everyone's kind of just they want to be in the weather. It's warm outside. They're gathering together. So it's really important that we also we keep safe and, be. And I'm sure Dr. Bowe can also talk about just hand washing, sanitizing, and how we can keep each other safe. And younger people going to their grandparents' house, you need to keep your grandparents safe as well. So that's also a concern that we want to give some information out in regards to that too.
Awesome. So, do you think we're especially with I know Chief mentioned about the younger officers and the issues he's seeing with the younger officers. Do you think there's a sense of selfishness that we have to contend with this younger? Well, I'm not going to say just with the younger generation, because I've seen older people. I've seen older people my age and older, who are still just as selfish and not willing to mask up. We see all the videos about people who are fighting against wearing masks in public places.
Mm-hmm.
How should we address this selfishness from old and young?
I don't know. I don't know if I'm going to say selfishness or people just really don't believe. I think that part of it is that myth of COVID, that if you can't see it, it's not real. But we know it's real. So I think it's just a matter of the educational component as well. I welcome anybody else to join that conversation. I don't know. I'm not sure how many people realize that, this is a serious pandemic. It's not germane to America. It's not germane to the politics. And I think the way that it was rolled out was very poor. And so with that poor information going out in the beginning, it just kind of, it just gave us more, not enough facts and a little bit more. I don't know if I believe everything that's happening right now. Yes. But we all have experienced the effects of COVID, and it is very real.
I agree. I think the politicizing this pandemic in the beginning has placed us where we are, where we now have 600,000 people who are deceased, close to 600,000 people who are dead, because we made it a political issue, made it a political line item instead of a humanitarian issue.
Absolutely, that's right.
It's like poverty. Poverty does not just happen in blue states or red states. It doesn't happen to just Republicans and not Democrats or vice versa, but it happens to people across the board. And here we have 600,000 people who are now dead because of a pandemic that we politicized. And now we're having to live with the repercussions on the other end of it. Yes. And I think that was a major danger. And I don't know how we're going to fix that. I don't
know, but we've traveled. So I know I've been out of the country and I've had to get vaccinations to go to different countries. So a vaccination is helpful. And I think, Dr. Bowe, you were going to speak a little bit about vaccinations and what that means to be vaccinated, so that people understand that it's important. If you're going out of the country, you have to get the vaccinations that are needed for that country as well.
Right. I think there's a lot of misinformation about people heard vaccine came to market within a year. What people don't understand is that this mRNA technology, which is in Moderna and Pfizer, was actually being worked on for 10 years. This technology was being developed to target cancer cells. So it really wasn't a new technology. It was something being developed over about a decade, right? And
let me pause you.
So
you're saying,
because, go ahead.
Can you go back? You're saying that this vaccine, the type of vaccine that we're dealing with, is not something that they just did in the last 6 months, over the last year. I'm correct in you are saying that.
Yeah. So mRNA technology. So what is mRNA? So it's a tiny strip of RNA which helps to teach the body to recognize the spike protein that's on the COVID virus. It's those spikes that allow it to attach to normal cells. So all it is a small strip of RNA teaching the body to recognize the spikes in a little bit of a lipid bubble. And that's the whole vaccine for Moderna and for Pfizer. Now the J&J vaccine is a little bit older technology. So it's being delivered in an adenoid virus, which is, similar to other vaccines that we've gotten over the years. So what I hear from people, is that they think this is just come off the market. It came right off the press for the last year, but it was actually technology being worked on for the last 10 years. It was going to be developed for something else, but it was the perfect technology to deliver this particular vaccine to us.
Wow.
I hope I
Awesome.
didn't confuse everybody.
I'm glad you mentioned that because that has been one of the leading arguments that I hear from people. In fact, I even had a relative who wanted to go word for word with me that, oh, I'm not taking this thing, and they just started working on it 6 months ago, and now they want to inject it in me. I might grow a third eye and all this other stuff. And you, right, the third eye. I don't know about that part. But and so for you to say that this technology is something that they have been working on for the last decade, it really says a lot. Now, is that the this technology there include? Is this the reason why there's such a difference in the effectiveness rate between the Pfizer and Moderna, which are in the 90th percentiles, high 90th percentiles, and the Johnson & Johnson, which is in the about 68% effectiveness?
Yeah, about 67%. But those numbers are changing as more people are vaccinated and we're getting more and more data in. So all three vaccines are highly effective. They think the J&J vaccine may be even more effective for the variants. We won't know that yet, but it looks that way. Any vaccine is a good vaccine. So any place that you can get a vaccine is where you should go. Now, I had a guy that I was vaccinating a couple of weeks ago, and he didn't want his family to know that he was getting vaccinated because they were very much about sort of conspiracy theories and this and that. And he literally asked me, you all, he literally said to me, I have to pick up my sister and brother-in-law at the airport later today. When they see me, will they know that I've had the vaccine? So there's just a lot of myth and misinformation out there. People are afraid of side effects. When I had my first vaccine, I had a bit of a sore arm, which happens with almost every vaccine you would ever get for anything. And then for my second vaccine, my temperature went to about 99. And I felt like I had worked out a little too hard in the gym. So when people hear body aches, they think, oh my God, this is just terrible. Look, it felt like I hadn't been in the gym for a while and I worked out a little too hard. It was
that would be me.
Taken. Right. So I took some Tylenol and I was fine. It's better than being on a ventilator, right? It's
Definitely
better than being in the hospital. It's better than having long-term COVID effects, the long haulers. An article came out yesterday about, brain function it affects brain function for the long term. I think being a little uncomfortable after a second vaccine is probably well worth it.
Yes. For those who have, thank you. And for those who have been vaccinated, what was your experience with the vaccine? And I'm of the mind that I think people need to hear the stories of those who have been vaccinated so they understand what we went through, because I've been vaccinated. I've been fully vaccinated as well. So what was your experience like?
Well, I'd like to respond to that. We kind of had a little laugh in our family because out of all of us that were vaccinated, of course, my mother is the eldest. So we were, a little leery and wondering if she was going to have some side effect. And she was the one that said, oh, no, I feel fine. I feel fine.
Wow.
I nothing hurts. I feel fine. I did have aches and a slight fever after my second dose. My husband, of course, had chills and was about to, faint after his second dose. My sister had flu-like symptoms after her second dose. My god sister had flu-like symptoms. My daughter had sort of a sore throat. So we all had, they didn't last long. It was done within 8 hours. 8 to 12 hours, we were done with it. But it was just funny that my mother had nothing. She had no symptoms at all. Yeah.
Wow.
And she's the eldest. So I guess that tells you something. Yes, that's how
Chief, go ahead.
Yeah, I had COVID in November, and I was
Wow.
down for a good 10 days with the fever, the chills, the cough. I had to go into 2 rounds of antibiotics and steroid to get the cough out, so I didn't have a pneumonia. And the vaccination was much less than actually having COVID. I wouldn't wish COVID on my worst enemy. On the way that it's relentless. That's the best way to explain it to you. It's a relentless virus that just continues to go and go. Thankfully, I was, healthy enough to fight it off without being hospitalized. But I was very lucky, knowing the severity of this virus, and it does. It's a relentless virus that does not give up. When I got the vaccination, the first vaccination, I had no issues. My second one, I was just tired. But I could tell you, living both worlds. Please get the vaccination because, like what Ms. Phillips said, is it's a pretty quick with the fatigue and stuff. But to go through it for 2 weeks compared to the vaccination, which was only lasting about a day, it's much worth it. I had the Moderna vaccination. So just to kind of give you perspective on both sides of what I lived.
Awesome. We have a person who commented, said hydration is the key. It's so important in this as you're going through. And I definitely, and Dr. Bowe is agreeing with you, Nicole. Yes, it is.
Pedialyte. Pedialyte was the best. Pedialyte.
Okay.
Not Gatorade because of the sugar. I can't tell you, but Pedialyte worked for me, and no, we stayed with the acetaminophen and Pedialyte, and that's what really worked. But Pedialyte, awesome. I buy Pedialyte to this day.
Dr. Thetford, did you have any side effects?
You can make Pedialyte ice pops too, by the way. And hydrate before getting the vaccine. If you're lucky enough to have a vaccine appointment, make sure you're hydrating well before you go for the vaccine.
Hydrate before the vaccine.
Before the vaccine, that's a good one. I never thought about that. No, Dr. Arnett, I have not. I registered for the vaccination, but I haven't experienced it yet. I haven't had it yet.
Okay, so you haven't had the vaccine. Okay, awesome. Yeah. Okay, I understand. Well, I had both shots, and I had Moderna. And let's see, the first shot, I had a sore arm, but being prior military, I'm used to vaccines. I remember in the Air Force, we went through the line and they just jabbed me in my arm with stuff. I had no idea, and my arms were sore. And at the end of the line, they gave me 2 Tylenols. So I did the same thing after I got the vaccine and went home, took 2 Tylenol and called it a day. And I was okay. Second shot, I did have chills and I was just tired. Yeah, I had a lot of chills, and then I was just so sleepy. And that's all I want to do is go home and go to sleep. And that's what I did. I went to school, did my job, and I told the principal, I got to go, I'm out. And I went home and I slept probably straight through the night, took some more Tylenol when I got home that day, and then I was fine, So I've heard some severe horror stories, but I'm like Miss Phillips and her mother. I was good, and so I'm grateful. And like Chief Fine said, I would rather those slight side effects than to experience COVID at its worst. Because I've had friends who have been in your position, Chief Fine. In fact, Dr. Thetford and I have a dear friend who had COVID twice, and the second time she's on oxygen now.
She still has pneumonia. She still has pneumonia. Yeah.
She still has.
Mm-hmm.
Wow.
Double pneumonia. She was on oxygen. She still has pneumonia. She still does.
So she's what they would consider a long hauler, correct? Because she got out of the hospital, almost a month ago when she got out of the hospital?
Maybe at this point, it's about 3 weeks to a month, absolutely. And she still has the effects, absolutely still has. But that was her second time. And actually, she carried it from to her family. And she was in the hospital, I think, for almost a week. Yeah, so it definitely has some, you can get it twice, you can get it more than one time. So that was also a key component. And the second time around is not always easy to shake off as well. So we just have to be knowledgeable about that. I did talk to a friend who had the second vaccination last night, and she was talking about her lymphatic nodes under her breast area were kind of swollen. So Dr. Bell, we were just talking about that might be an issue for mammograms. And if you're going to get a mammogram, possibly get it before getting the vaccination. I don't know whether you would be able to speak to that as well.
Yeah, so I would say yes, get it before, and wait a couple of months after a vaccine if you haven't gotten it before, because we are finding, or medical folks are finding that on mammogram, some of the lymph nodes in the axillary and also in the chest and in the breasts can be inflamed, for a little while. It's just part of our immune system. It's
Okay.
It's good news when our immune system works against a vaccine. That's what we want to see, is an immune system response. But yes, you could get some swollen lymph nodes for sure.
Okay. Yeah, I did have a coworker that had that experience. And so that's a norm. And you said that's a good thing.
Well, I think, we're all talking about these side effects, and, Dr. Therford talked a little bit about the mammogram. We want our body to respond to the vaccine. We want to get an immune response, because then we know the vaccine is working.
Awesome.
Our body is making those antibodies. The body is rejecting the spike protein. So we want to see a response. So it's a good thing to have
Dr.
some
Bill,
side
can you
effects.
talk about the spike protein? What actually happens with the spike protein? Does it exit the body? How does that work? So you get the vaccination. What happens next?
Okay, so if you're getting the mRNA vaccine, either Pfizer or Moderna, there's a strip of mRNA that's in a lipid bubble that's delivered to your arm. The body starts recognizing and making antibodies to the spike protein. It's the spike protein that allows the virus to attach to other normal cells and then, replicate and get us sick. So the mRNA also dissolves in about 36 hours. Once the body recognizes that spike protein and we make the antibodies to it, it's like pretty much in and out of our system in 36 hours.
Wow.
So it's a really good way to deliver this particular, vaccination.
So I have a question, Dr. Bao. I have a nephew who is, recently married, and they are planning to have children. They want to start a family right away. But she's concerned that if she gets the vaccination, it may have some effect on her unborn child, and it may be a negative effect. Do you have any information about that?
So, we don't have all the answers to certain questions.
Right.
People were very afraid that the vaccine would affect fertility. Well, there isn't any data that shows that. I've heard of pregnant women getting the vaccine, right? And then their child, when the child is born, has antibodies to COVID. I've heard that. I've also heard that some doctors are recommending that you don't get the vaccine when you're pregnant. So I think this is one of those situations where you really sit down with your doctor and you lay it out, and you talk about the risk benefit ratio, right?
Right.
Yes.
Yes.
So a friend of ours, Dr. Therford knows her too, had Guillain-Barré syndrome years ago. I think it was 30 years ago. And she hasn't had a vaccine all this time because there's some controversy about people with Guillain-Barré getting vaccinated. Well, now after there's some data and some research, I'm really pleased to say she's going to be vaccinated next Tuesday. And she's going to get the Pfizer vaccine, which seems to be the one of choice for folks with a history of Guillain-Barré. So she came to that conclusion through talking in her, groups for that, and also with her doctor. So that's what I would suggest people do.
Awesome. We have Dr. Bo. We have another question. Actually, it's from Pastor Covington, who asked the question.
Who I love. She's great.
They love.
I want you to know. She said she was trying to get on, but her tech team has deserted her. I'm not going to say who her tech team is, but I think one of her tech persons is on this broadcast with us, but I'm not going to call her by name, Dr. Thetford.
No, don't do that.
I'm not going to call her by name. All right. I'm not going to call Dr. Brita Thetford by name, but Pastor Covington wants to know, are they injecting the virus into us through the vaccine? Because that is one of the fears. That is a major fear we hear.
Right.
There is no live.
You are not getting. No, there's no live virus. There's no virus. And RNA doesn't change your DNA. It's not. We're not injecting people with 5G. I've had the craziest questions.
I've heard that too.
These are the myths. And so, no, we are not. The vaccine has no virus in it. No.
Awesome.
Tell her I said thank you for that question.
She hears you. She's on. But I think that is one of those things we have to be very clear with, because as someone mentioned earlier about all the conspiracy theories, and there are so many conspiracy theories out there. We've all heard some. I know the 5G. I think that one was like the Chief. Did you know they put in 5G in you when you got the vaccine?
I only knew about the tracker, not 5G.
Yeah, that's the other one. That they're putting the tracker device.
And we can laugh about it. We can laugh about it, but people really are afraid of those things. And so we have to meet them where they are. We have to be very carefully explaining to people the facts, because, myths and, untruths tend to really spread. And we just have to be really intelligent about this. We have to know the science, and we have to follow the science. And just because I know we're coming to the end, Chief Fine, I just really want to thank you for your style of policing and community policing, particularly the things you're doing in the community. Amazing. And so I'm just pretty impressed by that. And I want.
Yes.
I was taught by the best by Pastor Covington, and always stay close to sisterhood. But I appreciate it. Just know that it was how I was brought up in the agency. And thank you. But it's a credit to the community who pretty much raised me in my department and raised me in my career.
Awesome. I think Janice dropped out. No, okay. Somebody. Oh, Dr. Bo she'll join back in. Okay. She had some technical issues earlier when we first started, and then she'll pop back in.
Okay.
But again, we definitely Chief Fine. I want to echo Dr. Bo's sentiments. I think what you are doing, the programs that you've implemented, the initiatives that you are taking with the Burlington City Police Department are commendable. I think these are the things, especially in light of all of the social injustices we've seen with police in the community. These are things that Burlington County needs to see, and it needs to be publicized what you are doing in Burlington City, so people see police. There is a change in the paradigm. People are doing it. You are doing it. And if you can do it, others can do it as well. So definitely thank you for the work that you're doing in Burlington City, trying to keep people alive. And children are a passion of mine. And children, in fact, that's how I got connected with Pastor Covington and Dr. Thetford, because of the children. Children are a passion of mine, and what you're doing to help the children is amazing and phenomenal. So hats off to you, sir, for your hard work.
Pastor Covington always said, and I've talked to her and Dr. Thetford for years, and it's the preventative approach. If we got to the arrest or the negative interaction, we missed a couple steps before that. So we're trying to implement to support the family unit, to support the community before we even get to that interaction. So it's been successful. Our arrests have gone down, and the theory of arrests go up. If arrests go up, crime goes down. That's not exactly the truth. If you completely support the community, support the family unit, arrests will go down and crime goes down. So we've seen an example of that here in Burlington City. We just still have a lot of work to do. But I think that working collectively with Sisterhood, they are a staple of our community. It is showing success here in a small town where pretty much everybody knows everybody, but we're a small town with big city problems.
Yes.
Yeah, we are. Absolutely. That's well said. Well said. Dr. Bo is trying to join us back again. I know we're
Yeah.
almost through our time, but I did want to reiterate that April the 18th, Reva Foster is going to, at the JFK Center, Senior Center, there will be vaccinations available. The number has gone up. Dr. Arnett, you did a phenomenal job with just keeping us informed. Thank you so much for your work tonight. And Sisterhood, we're working on a trunk or treat for April 24th. We will be asking for volunteers and help for that event that we're hoping to have right in Burlington City. And once the location is secure, I'll give you more information in regards to that. So every Wednesday evening, we will be having our webinars, and we're excited for next week as well, because we'll also have our mayor on. We'll also have Senator Troy Singleton on, and also Representative Andy Kim will be on for next week, talking about COVID and how that's impacting Burlington County at large. So thank you. Dr. Arnett, I don't want to overshadow what you're doing.
Oh, no, you're doing fine. I'm reading comments. Thank you so much. And I did add that you're having your trunk or treat. Volunteers will be needed
Absolutely.
to help Sisterhood. We definitely want to be. What else can we do that, to help Sisterhood in your efforts? I know you said earlier, you mentioned earlier about you'll be distributing PPE.
Yes.
Do you have dates and other locations? Now you said to Friday, but will you be doing it anywhere else other than Sisterhood?
Good question. We are going to look to secure some locations. Again, Chief Fine and I were talking earlier about hopefully for vaccinations in the future, near future, we'll be working with Robert Wood Johnson to administer vaccinations in Burlington City proper. COVID testing, we're looking to do that also April the 16th. I do believe we're going to look to hand out PPE supplies and hopefully work with a strike team to also do a pop-up COVID test. So if you need COVID testing, if you've never been COVID tested, this is a very simple test now. It's no longer just the nose swabbing, but you can also just do a saliva test. And you'll have your results in 48 hours. So that makes it a lot easier than what we were all dealing with when we were, going through that swab in the beginning. We were like, apprehensive. I reverted back to like a 5-year-old. I was myself getting the COVID test, but it's a lot easier now. So if you can get COVID tested, please do. Please make sure that you're keeping yourself safe, because you could be asymptomatic and not have any symptoms at all.
Let me ask this question: with your pop-up testing, are you only limiting what your efforts in Burlington City, or will it be Burlington County at large?
Excellent question. We will, Burlington City is our focus right now, but anyone is welcome to come. We're going to have registration. And again, we'll put that information out on our Sisterhood website. But we will go to Willingboro. We're going to go to other sites. So Mount Holly, we're going to try to do that within May. But for April, definitely we're sticking with Burlington City, but people are invited to come for the April 24th event. Okay.
Awesome.
But great question. And we're working with the health department as well. So
I'm volunteering a location for you. If whatever we can do to help you, I'm volunteering a location for you in West Hampton.
I know that's great. Thank you.
If you're able, if your grant allows you to come out of Burlington City, then West Hampton is in Burlington County. Yes, and we'll be glad to partner with you to help you as well as a location. So you have that too for you. So again, I know we promised an hour, and the old Methodist in me and old military man in me likes to stick to what I say. And so I want to say personally, thank you to Ms. Phillips for sharing with us, and also to Chief Fine for sharing with us, and Dr. Bo and Ms. Foster, who was having technical problems, but I know she had stuff to. Thank you, Dr. Thetford, for sharing her information about her event on April the 18th. And so we are looking forward to just doing what we can do collectively, partnering together. And I think this is what's going to make it happen, doing these kind of partnerships and sharing truthful information with our constituents. So thank you all for sharing, and thank you, Dr. Thetford, for allowing us to do this. Oh, thank you, Pastor Covington, who has technical issues. And I'm going to pray for those technical support people who left you abandoned tonight. And I'm going to throw Chief Fine in there too, because he's on here smiling, and he should have helped you too. So we're going to pray for them, Pastor Covington.
Oh my
again,
goodness.
Thank you all. We have to laugh our way through this thing. So
Thank
thank
you.
you so much.
Yes, we do.
All right.
And you all have a great, wonderful night. Thank you all.
Thank you. All right.
Bye. Thank you.
Good to go?
Yes, sir. Have a good one. Thank you again, sir.
Thank you so much. Nice meeting you.
You too.